Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about another vitamin that is very valuable in the management of peripheral neuropathy. It's called niacin. Niacin is actually vitamin B3. It is a very powerful nutrient, and it has been found to be very effective in improving blood flow, decreasing pain, improving the functioning of motor and sensory nerves, and also improves other systemic complications such as cholesterol. Commonly, it was used initially to treat such things as schizophrenia, and it was found to improve schizophrenia significantly because of the improvement of the nerve functioning in the brain. But we found that it actually also works really, really well on the peripheral nerves and actually helps them to function more like they're supposed to. So the idea is niacin is something that we commonly don't think about. It's not something that we're going to do a blood test for to say, do you have sufficient amounts? It's actually something that we use as a specialized nutrient to improve the functioning of the nerves and to improve the blood flow. Recommended dosage is anywhere from about 100 milligrams 3 times a day to up to about 1,000 milligrams 3 times a day. It is a water-soluble vitamin, and just like the other water-soluble vitamins, you want to take it 2 to 3 times a day. Most individuals are taking it about 20 to 30 minutes after eating, and I'll explain to you why here in a second. The best form of niacin is niacin. Now that may seem obvious, but there are delayed release or sustained release or whatever you want to call it, forms of niacin or decreased flush niacin. All of these are not as effective at improving nerve function and improving blood flow. They are commonly going to be either niacinamide or inositol hexanicotinate, which don't function quite as well. So those are not the forms you want. You want true niacin. Now the problem, let me give you a real warning. Niacin typically produces a significant flush, which can present as redness, an itchy rash, burning sensation to the skin, feeling of heat, or prickly sensation throughout the body. This can be very uncomfortable, and to some individuals can be problematic enough that they're saying, I'm not willing to take niacin because of these side effects. Usually only lasts 15, 20 minutes. And most individuals, after a 2 to 4 week period of doing it, this starts to go away. The problem with niacin is if you stop taking it, even for a single day, these flushes come back and you're gonna have the flushes again for a period of time. If you do them with food, the flush is significantly decreased and is less of a problem. So I commonly recommend that you start with 100 milligrams, do it 2 or 3 times a day, get used to the flush, then you can increase it. The advantage of that is you can say, okay, by increasing it slowly, you're not gonna have as drastic of a flush. So if you said, I'm gonna take 1,000 milligrams 3 times a day, you're gonna have a major flush, major uncomfortable, usually not a good idea. So you start with the 100 milligrams and you kind of titrate up as you get used to the flush or as you find you need a little bit more. This is a very valuable vitamin. I recommend that it be considered. I recommend that you look at it, but you want the form niacin itself, not niacinamide or inositol hexanicotinate, just because they don't work as well. Can they work? Yes, you will get some of the benefit, but the true niacin is actually much more beneficial, especially with blood flow and especially in the functioning of the nerves. This is Dr. Brandt Gibson, and this is your Neuropathy Nugget, and I don't remember what day it is. Neuropathy Nugget day 79. 79, niacin. Think about it. It's a very valuable